Hello, how you doing? My name is Jamar, and I'll be your nurse today, and I will be performing a head-to-toe assessment on you. I will maintain your confidentiality and privacy. I will not release any of your information without your consent. You have the right at any time to refuse this. Do you have any questions?
No, sir.
Alrighty then. Nice to meet you there. Nice to meet you. I'm going to do a head-to-toe. I'm about to perform. I'm about to inspect your head. I am inspecting the hair. It's very moist, dry, without any flakes. The scapula and the cranial is intact. Doesn't feel any type of lesion or knots or bumps. Next, I'll be doing the face expressions. I'll be inspecting the client face expressions. It is symmetrical. The eyebrows are symmetrical. The eyes are symmetrical. The nose is symmetrical and the mouth is symmetrical. I am palpating the temporal arteries. Palpating the temporal arteries is 2+, pounding. The temporal arteries are good. Now I'm palpating the mandible joint. Open your mouth, please. Close. Open your mouth, please. Close. Palpating the mandible joints, I do not feel any crevices or anything of abnormality. Next, I'm just clenching the teeth. I want you to clench your teeth for me. I'm pulling down for resistance. Clenching her teeth for resistance, I do not feel anything abnormal. Close your eyes. Let me know when you feel this on your face. Do you feel that?
Yeah.
Let me know you feel it.
I feel it.
Okay. I just did a cotton wisp and she has sensitivity to face without any problems. I will be doing the cranial nerve 7 and I'll be asking her to follow my commands. At this moment, I want you to smile for me, please. Frown. Close your eyes tightly. Lift your eyebrows up. Show your teeth and puff out your cheeks. There we go. At this moment, to check the eyes, you mind keeping your glasses on for me? I'd like for you to close one eye right there and look at the line you can see, you can read the most. Can you see line number 5?
Yes.
Can you read it out for me?
P-E-C-P-D.
Great. I would like for you to close your other eye. At this moment, can you see line number 5?
Yes.
Can you read it out for me?
P-E-C-P-D.
Great. Now with both eyes, look at it with both eyes, please. Can you read number 5?
P-E-C-P-D.
Okay. At this moment, my client wears glasses and she has 20/20 vision. I'd like for you to sit back on the table, please. Okay, now we're about to perform a ocular movement. I would like for you to follow my finger as you do not move your head. The client will not move her head and she will keep watching my finger slowly. Just follow my finger. At this moment, the client has great accommodation or following my fingers back and forth. Now I'm going to use my pen light to assess the equal reaction to light of the client. I'm going to ask you to switch your glasses to the side for me, please. Just look up. Assessing my client's eyes is reacting equal to light, which is normal for when light is hitting the iris of the eye, it constricts, and it was 4 centimeters. And now we're going to test the accommodation and the coverage. I want you to focus on my finger at this moment. Look at the wall behind me. Look at my finger. Wall behind me. While she's doing that, focus on my finger and look at the wall behind me. it shows that her eyes are accommodating from constricting and to focus on objects that's far away. Now I'm going to inspect the eyebrows, the eyelids, and the eyelash. I am inspecting the eyebrows of the client. The eyebrows are 0 hair loss. The eyelashes are intact and they are pushed out forwardly. Checking out the eyes, everything is normally intact. I do not see any abnormalities at all. I am inspecting the conjunctivitis of the eyes, and it is pink. The sclera of the eyes is white, and the cornea of the eyes are clear, and the iris of the eyes are flat and round. So, inspecting the ear of my client will be the next thing you want to do when doing a head to toe assessment. So I am inspecting the ear of my client. The external of the ears are both symmetrical without any lesions. My client's ears are symmetrical without any lesions. Now we're about to perform a whisper test. Performing a whisper test, I will have my client to close. I will close one ear and whisper to the other, and she has to repeat whatever I say.
Dog. Cat.
Performing the whisper test, my client has repeated the words I said, so that is good to go. I'm going to inspect the nose. Inspecting the nose, the external of the nose, everything is symmetrically. And I will be palpating the patency of my client. I would like for you to close one nostril, blow through it, take a deep breath in. Other nostril, blow through it, and take a deep breath in. Doing that, my contour nose are patent. Palpating the sinus of the maxillary of the face, I do not feel any tenderness or anything abnormality. Palpating the frontal sinus, no tenderness or any abnormalities. I am going to inspect the mouth. While inspecting the mouth, I will make sure my client have a gag reflex, the teeth is intact, and making sure the membrane of the mouth is pink and it's white. I'm going to use my pen light. As my client opens up her mouth, the tonsils are removed. You have no tonsils. The teeth is intact, no cavity or decay. The mucosal mucus is pink. The pharynx and the larynx of the lungs are normal without any lesions on them. I'm going to use the tonsil thing. I'm going to make sure that my client is able to have the gag reflex. Okay, my client has a gag reflex, and it's normal when you push an object into a client's mouth, the reflex will occur. At this moment, I want you to stick out your tongue, please. My client sticks out her tongue, and the client tongue is symmetrically, without any lesions or anything. Right now, I'm going to palpate my client's neck to check the lip nodes of the neck, making sure that the lip nodes are not inflamed, swollen. The first one I'm going to check out is the front of the lip node. It's the preauricular. The preauricular lip nodes are in front of the ears. Then I'm going to check out the back of the lip node, which is postcoelicular. This is the back of the ears. Behind the neck is called the occipital. The lip nodes are fine and none tender to touch. Up under the chin, the lymph nodes are fine. Up under the top, called submental lymph nodes. Submental lymph nodes up under the chin. The tonsil, lymph nodes are good without any problems. The front of the neck, which is the cervical, is good. Back of the neck, of the lower neck, is the posterior cranial. Deep tissue runs down the finger. And subclavicle area lymph nodes are intact. And there is no swelling or any tenderness to the client at all. Now we're about to do some things with the body, the range of motions, and we're going to make sure that everything is moving appropriately. The first thing I want you to do is turn your head side to side, ear to shoulder. Extend your head backwards. Now I'm going to ask you to resist against my hands, which using your shoulders. At this moment, everything is normal movement without any confrontation. I'm going to palpate the trachea and making sure that the client trachea and the esophagus move appropriately within this manner. I would like for you to swallow, please. As the client swallowed, I did not feel any problems within the trachea or the thyroid moving up and down. Palpating the carotid artery. The carotid artery is 2+ strong without any problems. Now I'm going to listen to the carotid artery, making sure I don't hear any bruits or anything of that nature. Listening to the carotid arteries, there's no bruits. Everything has a swish, smooth, normal sound. I'm going to ask if it's possible, can you turn to the other side of the table? This moment right now, we're going to inspect the back of the client, making sure that things are within this area and there is no abnormality or any lesions. I'm going to lift up your shirt just a little bit to expose the back of your skin. I'm going to inspect the back of the chest wall. I'm just feeling, making sure that I don't have any, just palpating, making sure I don't have any humps or lesions on it. I'm going to perform tactile formalis. I want you to say 99 for me.
99.
99 for me.
99.
99 for me.
99.
99 for me.
99.
Doing that, did not feel any type of vibration. Everything was a normal flow of renaissance. I'm going to percuss. If there was any type of fluid or anything, it would be a dull sound. At this moment, there was hyper-renaissance, which meaning that it was a normal percussion. Now I'm about to percuss the back of the Casterville angle, which is where the kidneys are kind of located at. Just making sure that the client do not have any type of tenderness or any problems. Did that hurt?
No.
Next, I'll be listening to the breath sounds of the client. Deep breath in. Hold on a second. Deep breath in. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. The breath sound is clear bilaterally, and there is no adventitious breath sounds. The client is having unlabored breathing at this moment. Now we're going to inspect the arms, making sure that things are moving symmetrically. The client's arms are in length, symmetrically, without any lesions or nodules or bruises on the area. I'm going to palpate the brachial pulses. The brachial pulses is 2+ strong. Palpating the radial pulses. The radial pulses is 2+ strong. I'll let you hold your arm out this way. Palpating the ulna. The ulna is 2+ strong. Next, I will ask to check your capillary refill of the finger. Its perfusion without any problem, less than 3 seconds. Good capillary refill is what we need. That means that the heart is pumping adequately without any compromise. Next, I'm going to ask you to follow some range of motions. I want you to flex your arms outward. Place the back of your head. I want you to adduct outward and adduct in. Flex your elbows. Hold your hand outward. Subnate, pronate. I want to push down against resistance without any problem. The client has a good range of motions. Now I want to get your wrist. Stick your hand out. Hyperextend. Fold down. Make a fist. Spread your fingers open. Now I want you to touch each one to bring your range of motions in. Just like that. Great. Each one. Now I need for you to take your hand, touch your nose, other hand, and touch your nose. At this moment, cerebral function is intact. Now I have 2 things I'm going to use. The client will not know what these 2 things are. She has to be able to tell me what these 2 items are without looking at them. I need for you to close your eyes, please. I'm going to place this in your hand. Can you tell me what this is?
Paperclip.
Correct. I'm going to place this in your other hand. Can you tell me what this is?
Cotton ball.
Correct. That was letting me know that she's able to decipher objects without even looking at them. I'm going to practice on her graphothesis, which she will be able to tell me what I do with her hand as I place a number in. Can you tell me that number right there?
7.
Can you tell me that number right there?
8.
At that moment, she was able to graphicize what I have drew in her hand. Next, I will be working on her reflex of her arms. You stick out your arm for me, please. Hold on a second. Just relax for me there. Just relax. Just relax. Alrighty then. Just let this arm right there stay. I'm going to hit this right there. The bicep muscle has a reflex. I'm going to do it again, so making sure that it can be seen. Alrighty. The bicep muscle, when I hit this right here, it will jerk at a certain once I hit the reflex. Just relax your arm and the biceps will flex just a little bit. It will have a jerky movement. There you go. There you go. Making sure that everything is working symmetrically, we want to make sure we check both of them. Okay. It has a reflex without any problems. I will be checking the reflex of the elbow. And as this occurs, the arm will extend out slowly without any problems. It will not be a fast, it will be like a small quick jerk. I would like to relax your arm, please. There you go. Alrighty. That was both for checking the triceps and the bicep reflex. Those they work appropriately without any problems. Next, we will be checking on the brachial reflex of the arm. When I do this, the finger will have a certain jerk to it once I hit this area. At that moment, the reflex is intact. It lets us know that there's no problem with the brain stem or any of that nature. I'm going to ask you to lay down on the table, please. I have inspected the chest, and I make sure the chest it was free of any tenderness. Now I'm about to make sure that the client chest rise symmetrically once again, laying down. It rise great when she was sitting up. So take a deep breath in. Blow out. Making sure that the chest rise equally, the lungs are doing great. I'm going to auscultate the heart of the lungs, making sure that the pericardium, the aortic, the pulmonary, the mitral valve, and the tricuspid valve, using my diaphragm. Listen to the heart. S1, S2 are normal. Did not hear any S3 or S4. And everything is clear with a swish sound and did not hear any murmurs. Next, I'll be working with the client's abdomen, making sure that everything is intact without any problem. We're going to inspect, auscultate, percuss, and palpate. That is the correct sequence of doing the inspection. Lift up the client's shirt, making sure that the abdomen is not exposed too much, but keeping the client covered up with, and make sure the privacy is good. So right now I'm inspecting the abdomen, making sure that everything is looking good. So I'm inspecting the abdomen. I did not see any lesions or bruises at this moment that are on the stomach's abdomen. I am inspecting the client's abdomen, making sure that everything is symmetrically moving up and down, making sure that the abdomen is good when it's make sure to breathe on the diaphragm. and inspecting and making sure there is no hernias in the area that is located. Now I'm going to auscultate I just auscultated the aortic of the abdomen, and there is no bruit sound. And you making sure that the renal artery is heard too. There is nothing, there is abnormality. Now we're going to percuss. Before I percuss, I want to make sure I inspect the bowel sounds before I percuss. Inspecting the bowel sound is active. It's not hyperactive or hypoactive. It's normally doing what it needs to do. Now I'm going to percuss the 4 areas of the quad using my fingers and hit tapping with my hammer. There is nothing abnormality at this moment. Everything was normal. A light palpitation of each quad. Do you feel any tender, any pain, anything?
No, sir.
There's no tenderness or pain, the client has stated. Now I'm going to do a deep palpitation, making sure that I can feel some of the organs within the client's. Feeling the liver, which is the right upper quad of the abdomen. Is that hurting you? I'm going too deep?
No.
Everything is normally fine and it's in its proper location. All right, making sure that the client legs are symmetrically, they are intact, and there is no difference in the legs. I'm going to palpate the popliteal arteries, 2+ strong. Palpitate the tibial arteries, posterior tibial arteries, 2+ strong. Palpitate the dorsopirialis, 2+ strong. I would like for you to stay on your back, put your legs straight in the air, 90 degrees, bend at your knees to your chest. Put your feet straight out and bring your legs back in towards in. Proper range of motion of the legs. You can relax there, please, without any problem. Now, I would like for you to turn your feet outwards, inwards. Push your feet up, down. At that moment, nothing is there. The client has great range of motion. We'd like for you to sit on the side. We'll make sure the client's reflexes are intact. That's the patella reflex hitting the top at the bottom of the knee. It was jerked out normally. Next, I'm going to do the Achilles reflex. And the foot will jerk just forwardly. The Achilles reflexes are intact bilaterally. The Achilles reflexes are intact bilaterally, and there is no abnormality. Now we're going to perform the Babinski. The Babinski is making sure that the client feet is spread out. It should not go inwards or anything of that nature. If it go inward, that'll let us know that you have a neurological problem. And you start from the bottom and the toes flare out. The toes flare out. Now I'm going to ask the client to lay back down on the table. And I want you to rub your feet across your leg using the opposite, using the other one. At that moment, there is no problem with the brain. She's able to follow the commands and be able to touch the function. Now I'm going to ask you to sit back on the table. I would like for you to get up. You could be able to stand up for me, please. Starting from right here, I want you to walk on the heels of your feet. Now turn back around, walk on the tippy toes of your feet. Hop on, come back in right here, hop on one leg, other leg, you can stop. Client's able to follow commands and do. Now I'm going to ask you to close your eyes and stick out your arms. There is no swaying at this moment. Testing the Rumber's test. I'm going to ask you to turn right here. Bend over, please. Stand up straight. Keep your legs straight. I am expecting the spine. It is midline. Are you feeling tenderness or anything like that?
No, sir.
No tenderness or anything. I would ask for you to touch your toes. Bend sideways. Stand up for me. You can look, I'm sorry. You can look up. Look towards me. Bend sideways. Bend backwards. And twist your shoulders. At this moment, this is my head to toe assessment. I thank you. My name is Jamar Reed.